I am Dr. Vivek Verma, Director Orthopedic Oncology and Joint Reconstructive Surgeries at Max Hospitals, Delhi. Today, I am going to demonstrate you the different type of products that we use in tumor prosthesis and revision joint surgeries. So we have seen different types. Now I'm going to show you the composite resection. A composite resection involves both your upper tibia as well as your distal femur. So individual components remains the same. Only the thing is that you are replacing the entire distal femur with the upper tibia, and then this gives you a complete resection of upper tibia and distal femur, like an extra-articular knee resection. So once we lock it, you can see that this composite segment rotates. It's all stable, and it is a movement of both the components with complete stability. So where do we use this system? This I am going to show you now. Thank you. So now we are going to show you the proximal tibia resection. So once you have done the soft tissue dissection, the minimum resection is 8 centimeter. So if we look it from the tibial base, so this is your 8 is somewhere here, which you need to mark it with a pen. Now we are going to take the cut with the saw. So once you remove this, there is a large defect. Now you need to ream this side. So once we have cut this, we are going to enter and ream the canal. So you need to check after reaming that this is going inside. So yes, it fits well. Now if you focus here, so this is a beveled edge. It's not straight edge, it's a beveled edge. So you need to prepare this canal for this beveling. So now we are going to take a distal femoral cut. Once you have dissected the soft tissues all around, you need to measure the length, how much you're going to cut. Let's say the minimum cut here is 80. So which comes here. We are going to use a scale to mark it up. This is our cut level. So we dissect out completely, and then we use the saw. So once we have cut the distal femur, we need to ream the canal. You go in, you go with different lengths. So now I'm going to show you the composite type of reconstruction. So here you can see this is the femur part, the distal femur is cut, and this is the tibia where the upper tibia is cut, and this is your malleolus. So now in this we need to reconstruct both the upper tibia and the distal femur. So it's always advisable that you start with the upper tibia. We take this stem, we push it in. Now the second part is your femur. We take this femur, we push it in. Now we need to fix it. Now this goes inside. So once you have locked it, we need to control it with this bumper. Then we take it out. So this way our entire composite resection is ready, where you can have both the distal femur and the upper tibia. So this is your composite resection where we have put the entire composite thing, where the proximal tibia and the distal femur is taken care of.